think for once the closed captions are 90% correct so far. But it's still early.
You don't need to breathe.
They keep getting better. You're absolutely right.
They do.
All right. So this isn't looking right.
No, it is not. What did you do?
Oh no, we're gonna try something else here, folks.
That's actually
Let's try that. Oh,
maybe click and drag it over.
oh no, there we go.
That.
Okay, I'm gonna get. Maybe I'm slow starting the year. That definitely could be it.
Right.
Oh.
Okay, that's new.
No, that's kind of what we want. All right. I think I might have figured out what I'm doing this year. There you go.
All right, can everybody see that?
I can.
Yay!
Awesome. Thank you. Speaking of which, let me see if I can get the chat up in case you have any questions that you want to put into chat. So tonight we're going to be talking about bridging the gap, the transition from pediatric to adult healthcare. And because we have the wonderful Hunter Markle with us tonight, we are going to get personal and learn a little bit about his journey, your journey, along with the tools and the assessments that we recommend. Sound okay?
Yeah, I just wish these assessments were around when I was doing this.
It would have been helpful, but
100%.
I really didn't know what was going on either back then. So
A lot of people didn't.
yeah, we're figuring out how to stay
Including the
going.
medical professionals.
True. So tell us a little bit about yourself.
Well, I am now 25 and am working at a local grocery store, and I am loving life.
Cool.
I'm also drinking a Warhead soda.
Ooh, sour.
Hmm.
Now, the sour as you'd like.
Sour enough.
Okay, cool. And I'm Hunter's dad. I also work with the Youth Health Transition Initiative for Wisconsin, and then director of the Southern Regional Center. So who the health transition is, we are part of a collaboration in Wisconsin. We have partners throughout Wisconsin, including ABC for Health, who helps us with some health benefit stuff, while Badger is a wonderful resource center. We work with our medical home initiative, which is one of our national performance measures through our funding, which comes through the Maternal Child Health Bureau. So medical home, which is basically, hey, you need a place, a home base to take care of yourself and your healthcare. And we're hoping that we get more and more people who don't just have a clinic, but have a medical home. We also work with a couple of parent-to-parent matching places in Wisconsin. And Family Voices Wisconsin, which does a lot of great stuff on advocacy, has some really cool fact sheets as well. And then most of all, making sure that you know that there are 5 regional centers throughout Wisconsin. And we are here to help provide linkages and resources and referrals and help you understand what the system's doing and how the system's going.
I still feel like we should use 4 regional centers, but I didn't draw up this map.
No, it's based on the fact that Wisconsin has 5 public health regions.
I know, but I feel like it would be more simpler for 4.
Yeah, but if everybody else in the public health, because we're funded through the public health, if everybody else is using 5 regions, shouldn't we use 5?
Yes.
Okay, moving on.
Still,
So 5 regional centers, including the one at Southern Regional Center, which is at the Waisman Center, and that's the one that covers Madison Metropolitan School District.
why is Marathon County so big?
So we are, I don't know, it's a large, it's got a lot of land.
Yeah, true.
So we are with the Health Transition Wisconsin, supporting youth to adult healthcare transition. And because of the fact that I have to have fun in whatever I do.
He says it spells out Yeti.
It does, Youth Health Transition Initiative.
It somewhat does, but
Yeti.
here's the thing. He uses the picture for the abominable snowman from Rudolph the Red-Nosed Reindeer.
That's a good point. Okay, so really that is the Bumble, but I thought it was more adorable than any of the Yeti pictures that I found. So we went ahead and we went with it.
I mean, you're not wrong.
So do you want to talk a little bit about our purpose as a Health Transition Wisconsin?
Primary purpose is to give out resources to families who aren't fully connected or understanding what healthcare transition means for their children or themselves and everything. Because again, I wish I had these resources when I was transitioning. It will also, excuse me for a second there, help with teaching, well, teachers and other healthcare providers, be them nurses, doctors, or even professors at, say, a university, to help them reach out more to their students, to their patients, to family friends as well, because there are a lot of families out there, as I said, who don't know what healthcare transition is.
So when we're talking healthcare transition, what we are looking for is a high quality, developmentally appropriate healthcare services that are given to the patient in an uninterrupted manner as a person's moving through adolescence to adulthood. So that space of adolescent, young adult.
Yep.
And so wanting to make sure that they have this continual health care and they understand how to manage their health care as an adult.
Yep. Or at least attempt to.
Yeah, correct.
Because we are human and not machines.
We are human, and independence is a myth, is we all need support.
Yes.
We all need other people.
Yes.
All right. So want to make a little distinction between what we're talking about as transition, which is the transitioning of the healthcare, which is a process that can begin in early adolescence through however old it needs to be. But there will be a actual transfer of care, which hopefully takes place sometime between 18 and 22 years of age. And that's when there's an actual change with who is helping that patient determine and make those decisions for their healthcare. Who's their primary doctor? Who are their specialists? And so there should be, in most cases, there's a transfer of care. Even if someone has a family doctor, they may not transition doctors, but they're transitioning systems from a child-based adolescent system into an adult system.
Yeah, that might hurt the child a little more than it should, but that's sometimes what happens.
Yeah, so there should be a transfer of care at some point.
Yep.
So
will it be easy? No, because nothing in life is easy.
You're in a sort of downer mood tonight.
More of a roller coaster.
Oh, okay. So what we're talking about with what we do is we support healthcare providers and organizations to help move their transition efforts forward. So we have a nurse practitioner that meets with anybody in any system, medical system, that wants to learn how to implement healthcare transition, not just in their own office, which is great, but also we would like healthcare transition be implemented system-wide throughout each health system that is in Wisconsin.
That's the goal.
Is we think that the medical department should use their records. They have records of exactly when everybody's turning 18.
The records that are on the computer or the records in their archives that haven't been dusted off since the 1800s?
These would be the ones in the computer.
Okay, then.
And so they are aware of who's turning 18.
Hallelujah.
And so we're hoping that they will help those patients prepare for that transition.
Let's hope they have enough people hired to do so.
Well, that's one of the problems. So what else does youth health transition do?
It also helps with the youth side of things by giving them access to booklets, to transition guides, to asking their parents, hey, can you explain more about this part of the healthcare transition? Or how do I do this on my cell phone for emergency contacts?
Good point. And we have a website. And that's okay, Pat. Go on, come back, do whatever you need to do.
If you want the recording, we'll make sure to get it to you.
Get the recording. So we do have a website. We do a lot of outreach and a lot of trainings.
Yep. No, this guy won't be in all of them. I will tell you that much.
Absolutely not. So what we're going to do tonight is we're going to talk about what exactly is this healthcare transition thing that we're talking about. We're going to introduce what's called readiness assessment. Going to go over 8 tools for healthcare transition.
I already mentioned one of them.
Yes, you did. Good job. Good foreshadowing.
You're welcome. I like a good foreshadowing.
Nothing like a good foreshadowing.
No.
And then we're going to hopefully talk about ways that youth could talk about, help them talk about their own healthcare and advocate for their healthcare.
Which is really hard.
It can be standing up for yourself and speaking for yourself and making your own decisions. It's not easy.
No, much like getting out onto that rock in the picture, which I
Yeah,
just
so-
noticed that is a very well chalked on walk.
It is.
rock.
So what's the story of this rock?
Well, that was taken up in the Door County region,
Mhm.
in an area known as Fish Creek and everything. And it was for my grandparents on my mother's side's wedding anniversary. Don't ask me how long, I don't rightly remember. But it was at first a cousin of mine going out, then my sister, then both my mom and dad, then my cousin and sister. And then my dad was like, "You want me to walk out with you?" "Yeah, sure." And snap picture.
Yeah, and all of that did not happen automatically.
No.
Like you said, there were other people going out on the rock. We
Yep.
didn't push you out on the rock.
No, thank goodness for that. I would have slipped and fell.
I could have carried you onto the rock,
You could have.
but I didn't.
It would have looked weird to people.
That's true. It would have looked really strange. But once you had the confidence and you had the knowledge that the rock was not going to go anywhere.
Well, it
you
did
took
go
that
somewhere.
step.
It went underwater.
Yeah. So years later, we go back and we take a look at this rock and what happened.
It's underwater.
It is totally underwater. The lake has risen, and not even I would go out on that rock these days. It's not.
And yes,
available.
Bumble has made his appearance yet again.
Yep. So if you're looking for something else to do, feel free to count the number of Yetis,
Yep.
and there will be a prize at the end.
The prize is what? The email push of this
Oh,
recording?
yeah, no, that's right. We don't have a prize. I'm sorry. There will be no prize. Good point.
No, the prize is listening to us talk.
So healthcare transition, as we already mentioned, is a process of changing from pediatric to an adult model of care. So even if you don't have to change doctors, the model of care will change. And sometimes the hospital that you're allowed to go into will change. Sometimes the way that visits are done are going to change. Sometimes you get everything done as an adolescent or a youth, as you'll get the testing and everything done all at once. As an adult, you may have to schedule those things on your own and separate from your visit going in. And so there's a lot of things to think about and a lot of changes that can occur.
Mm-hmm. Hey, got transition.
So who needs to think about transition, Hunter?
Everyone.
Pretty much.
Well, everyone over the age of 12, 13.
So right around 12 and 13, you
Would
want to
be-
start thinking about that
Yep,
transition.
that would be the time. If I was a teacher and everything, I would be pulling up Got Transition and going, "You guys want to take this home to your parents to talk about and everything, and then you can bring them back to me and I'll explain what this is."
And how about if you're a parent, about the same age or a different age?
Possibly a little older and everything,
Okay.
like 14, 15, maybe 16 and everything, because that way then your child would be used to the moving of the healthcare and everything, and you can sit them down and explain it a bit better. And also they might have their driver's license, or at least their temporary ones.
We will get into driving a little bit later.
Oh, joy.
But there's a definite benefit to starting early, practicing some of these skills,
Yep.
getting some of the knowledge in, and definitely starting with this attitude of I can do it and I can take charge.
Yep. Especially if said kiddo has a disability of some sort, be it a physical one, mental one, or just in general a disability.
So why is that important?
Because some of them might not understand it, or their disability is very hard for them to do other things, or it is a health disability like scoliosis
Mhm.
and everything, and they need a specialized care team to help them with that. But because they're transitioning out of the child practice area of healthcare into the adult world, it means that their care team might need to change completely. And
Absolutely.
these kids might have grown up with these doctors and
And it's
nurses.
really hard to leave a place that knows you and that you're comfortable with.
Yep.
And so having that time of transition to try to get comfortable with the fact that things are going to change, it's really important.
Right.
Along with the fact that we really want to encourage a continuity of care.
Correct.
And we want that healthcare, whether it's mental or physical care,
Mhm.
to be consistent, that there's not a
Yep.
lag or a drop off, because bad things can happen during those legs or drop offs.
Yep.
So let's talk just briefly about why health is important. So
Told you it would work.
why do you think health is important for independence?
In the fact that you can do a lot more, you can get out more, you can hang out with your friends, your family, a special someone if you have a partner in your life.
Sure. And that can lead to better success in day-to-day life.
Correct.
And then you went to Madison College for a little while.
Yes.
How did your health interact with being successful at college?
Basically helping with keeping my mind straight, with learning from the professors and everything of that sort, being able to learn what they were teaching, being able to have the help needed to write some of the projects I needed done and everything. And the dog is very needy tonight.
So with the needing of some help, the accommodations, as they called it,
Yep.
did they like seek you out and search for people with disabilities, or how were you able to get those?
No, they have an entire. Oh, I am trying to remember. Department
Okay.
devoted to setting up accommodations for those with disabilities and everything.
And you have to go to them.
Yes.
Okay.
It is not them coming to you, you go to them. Why did it take me so long to think of that word?
I don't know. And then you mentioned that you're now working at Pick and Save.
Yes.
How does your health interact with how you're working? What does that have to do? What does health have to do with employment?
It means you can work.
True.
It means that you'll get a paycheck. It means that you get to have customers, healthy customers,
And do you understand what to
and healthy
do?
coworkers.
Yes, that's important too. Do you understand what to do if you don't feel well?
Yes.
You know who to call?
Yes.
Do you know what to do if you are at work and you start to not feel well?
Yes.
And have you told anybody at work? Have you told anybody about your disability?
To the person that hired me and a couple of handful of my coworkers. And I'm assuming a few more of my coworkers can piece everything together.
Okay. So, but you don't tell every customer that comes up.
No,
Okay.
because I don't know their views on the whole debate between is autism such and such, or is it a disease caused by such and such?
Okay. So you get to choose who knows about your health condition.
Correct.
When you were younger, you didn't have much choice in that.
No, but when I was younger, I wasn't diagnosed.
That's a good point as well. All right, time for a little quiz, bud.
Oh, joy, I love quizzes.
Age 16 in America, what's the major thing that happens?
Driving.
Yes, getting your license. Do you have your license?
Yes, now I do after 3 attempts.
3 attempts?
3 attempts.
Awesome. And why did
Still
you?
calling the second one BS on.
And did it? Well, I guess you get to do that. How long did it take you with those 3 attempts? Was it 3 attempts in 6 months, in a year?
About a year and a quarter.
Okay, about year and a half or so. Was that as quick as you wanted it to be, or what was your attitude about when you wanted to get your license?
I wanted to be more of a safe driver than a quick driver.
Okay. It was, I remember it was really important to you that you felt comfortable.
Yep.
And that took time behind the wheel, and it took practice. It's just like working with your own healthcare.
Yeah.
It takes time and practice to get comfortable with it. So that's why we want to start younger. So you got that one right. Good job.
Yay.
Age 18.
Voting for our politicians.
Yes, that is very important because there are a lot of issues that people with disabilities need to be aware of because we need some funding from the government. And so
State and federal
and local. And so it's important to understand your right to vote. What else happens when you turn 18?
You become an adult.
Yes, you become legally responsible.
Whoa.
How about age 21?
Becoming good friends with Jack, Jameson, Jim Beam, and a few other named drinks.
Yes, so you're
which you need to drink responsibly 100%.
There you go. So you are then able to drink responsibly legally.
Yes.
So these are all different milestones. Well,
the big one is adult.
Right. And so the big thing that happens is we want people to know that we want all of our kids to grow up to be adults.
Oh.
That's the goal.
Yes.
And some of them are going to be able
The
to
question
have.
is, how mature of adults do you want?
I'm not sure how mature some of the adults are that I know.
Good point.
I'm not sure how
Good-
mature I am.
Good,
To put it that way.
good point. I keep forgetting you're friends with Nicole.
No names, no names, no names. And so we know that we want youth to be in charge of their lives, to be self-determined. And we know that that's going to be different from youth to youth.
Yep,
But we know that no one's going to be totally independent.
true.
Is we all need help and we all need support.
Yep.
But if we know that this time of adulthood is coming up, then let's prepare for it.
Yeah.
And that's where we
Stepping
talk
stones.
about, yes, stepping stones to taking charge of adult healthcare. That there are things that we think you can do starting at age 12 to 14. And then moving up and doing a little bit more. So you could start talking about transition at around 12 and 14. And then you could start to be in the know at 15 to 17, know your medications, know your health systems, know how to make appointments, know your insurance. Until at 18 and up, then you are the adult, you are the decision maker in your healthcare. And so
Yay.
what we encourage people to do is to think ahead and then back it up and
Yep.
stay that step ahead.
Or at least try to stay a step ahead.
Try is a really good man. So what are we going to talk about?
The 8 tools of transition, which we both have named one.
Ooh, I can't wait to figure out which one I named.
Oh gosh.
I have no idea what I did. But do want to remind you that we do have an awesome website.
Yes, and a workbook, which
Yes.
we will not be pushing out because we don't want to break the emails.
Correct, but the workbook is available for download from the website, and it basically gives you more ideas around the 8 healthcare tools and gives you some other resources. So I would encourage you to check that out as well. And yes, we will include that link in the resource sheet.
Yay.
So let's talk about some of these tools. Have I talked about KSA yet?
No, you have not.
Ooh, so this is my newest thing. So this year, I'm like framing stuff in KSA, that there are things that you need to know to succeed in transition. There are skills that you can build and practice. And then there's this attitude of independence, this attitude of self-determination.
Yep, which
That
is
you can
very
have
key.
to. And so during this high school time between 12 and 18 is a great time for KSA. To
Elementary,
build
middle
the
school, high
knowledge.
school.
Yes, actually younger than high school, we're finding
Yeah.
that students can actually engage in this, and families would appreciate having resources
Fourth to
even
12th.
younger.
Let's just say 4th to 12th grade.
That'll work for me. It's a great time to start building knowledge, skills, and attitudes,
Yep.
the right attitudes. So let's talk a little bit about
Yeah.
adult providers. So if you see a pediatrician, which you started off with a pediatrician,
Yep.
eventually, pediatricians are designed to take
And
care of
little
people
kids.
under, yes, actually anybody under 18. So even teenagers, they're trained to take care of.
Really?
They are. Now, you had a unique sort of experience
Yeah.
in that I went and I talked to your pediatrician. I'm like, Hunter's a teenager now and he's getting old enough. Would you spend a little bit of time alone with him so that he has a chance to talk to you?
Yeah.
And
yeah.
do you remember what the pediatrician said?
Why?
He did say why, because I guess I didn't explain it very well. But that was kind of a little disconcerting to me because I wanted him to be your doctor, not my doctor. He's your doctor. So then I asked you, do you want to spend a little bit of time with your doctor?
Why?
It's the same question. So obviously I have problems with explaining things. So
And I have problems with understanding them.
So after I talked a little bit more to the pediatrician, I thought maybe this wasn't quite a good fit. So I was seeing a family practitioner. And so I introduced him to Hunter. And did you guys, what happened?
We clicked like 2 missing pieces of a puzzle.
You guys did. So what was it about your new doctor that you really appreciated?
Beyond the fact that they're very funny, they dumb things down enough that I can understand them and I can read their handwriting.
And how about their staff? How does
their staff is
treat you?
amazing. I really like the staff at the hospital that the doctor works at and everything. And they always have a smile on their face despite the masks. Thank you, COVID.
It's true. They are all masked up still, aren't they?
Yep.
Absolutely. So would you, how else, do you have any other ideas about how people may be able to find adult providers if they have a pediatrician?
Reach out to your family friends, or
Yeah,
even just ask your hospital
there you
or
go.
your insurance company.
Talk to your doctor, talk to other families that maybe have kids with similar disabilities, find
Yep.
out who they go to.
Networking is key.
Yep. Now, we do realize, though, of course, that especially in some of our rural areas, or depending on what insurance you have, you might be a little limited.
Like our area,
Right. You
well,
might be
our neighborhood.
our neighborhood. You might be limited in who you're able to go see. And so in that case, you try to work with the doctor as best you can.
Yep.
Sometimes it's not a perfect match.
No.
So when we talk about decision making, do you know what we talk about when we talk about decision making?
The decision making of what adult provider you want to go to, what
That would be a
hospital you
decision.
go to, which insurance you wish to have as your primary Medicaid,
Mhm.
Medicare. So
Don't worry about
no,
it. Just say
that
insurance.
insurance.
Yeah, it
just
gets
straight up
confusing enough.
insurance.
Yeah,
Oh.
it's confusing. What about decisions about, do you want to take this medicine or not? Whose decision should that be?
Yours.
Okay. So there is a point where you want to be that decision maker,
Yep.
where you no longer want me or your mom saying, Hunter, you need to take this medicine. You want to make that decision.
Well, I still want you guys' input on it.
So you want to be supported
Yeah.
in your decision making.
Yes.
Okay. So when we talk 18, we're talking about, especially with healthcare, we're talking about how can we support that adolescent to make the decisions. Now, there are some cases where where people have to look at guardianship, or that youth is not ready, is not able to make those decisions. And so they may need guardianship. They may need a power of attorney. Now, our next session will be somebody coming in and talking about supported decision-making and guardianship.
Yay.
So tune back in a couple weeks and we will
Please tell
cover
me
those
it's not a
topics.
lawyer.
I can't remember which one I have coming in. I'm sorry, but there's a really cool lawyer that I know that does the talks.
Okay.
So decision making. And
Yes.
see, decision making, what would it be like if all of a sudden you turned 18 and all your life I've done everything for you, and then all of a sudden 18 I said, okay, well, your turn. You decide what to do. How would that make you feel?
What the heck?
Yeah, you'd probably be a little terrified. So
Yeah.
luckily we didn't raise you that way.
No.
We raised you helping you make those decisions, making any decisions along the way. Do
Yeah.
you want to do this or this? Would you like to go here? Do you want to go there?
Would you like pepperoni on your pizza or just cheese?
Right, exactly. Or in your case, growing up, you want sauce today or not? You and your sauceless pizzas.
Hey, it was delicious, okay?
Mhm. So thank goodness.
Pizza never questioned it.
Okay, good point. Good point. So that decision making is one of those skills that can be built up over
Yep.
time.
Yep.
Let's talk a little bit about health insurance.
Very briefly, seeing how we covered the majority of it outside of making sure to keeping your insurance card on you.
Where do you keep your insurance card?
My wallet, which pretty much goes almost everywhere with me.
Good
Outside of the
job.
house at the very least.
And what information do you find on your insurance card?
The on-call nurse,
Mm.
the main person to call if you have insurance questions. I believe the next phone number would be your parents, maybe, or I know there's a
Not gonna
third
be on
number.
the card.
I know there's a third number on that card.
Oh, you're gonna have to go back out and figure it
I
out
am
because I
going to have
have
to
no
figure it
idea
out.
what you're talking about.
Where's yours?
It's in my wallet.
Anyway.
Anyway,
Yeah, moving on.
moving on. So when do you use your insurance card?
When you're doing appointments.
Yeah, sometimes they'll ask for it, won't they?
Yep.
Okay, and so
Or at least check to see if you're on this insurance plan, which was very helpful for myself, would have been very helpful for my sister.
true. Now with that, so it lists what insurance you have,
Yep.
and then like your policy number so they can look it up and make sure that you're allowed to see
That
the
might have been
doctor.
the third number on there.
It
I
could
mixed
be.
that up with the phone number.
So it is important because what you were talking about is learning about, health insurance is not easy to figure out.
No, there's in care and out
Oh
care.
my gosh, yes, in network, out of network.
Thank you.
So do you know the difference between a network and out of network?
In-network means you won't be billed for over $500 just to see a simple doctor.
There is a difference in price, absolutely. And so you want to make sure you understand what your network is.
Yeah,
And that you want to do everything you can to see your network doctor. And if you can't, that you call that number on an insurance card and say, look, I'm somewhere away from my doctor. I need to see someone. What can I do?
what hospital do you guys cover?
Exactly. Or will you pay for
Yep.
it? Cool. Let's talk emergency contacts.
Yay.
All right. So it's important to know, to have people as your emergency contacts in case something should happen to you.
Yep.
That the paramedics or somebody would be able to get you help.
Yep.
So what would happen if you were driving along somewhere and you got in an accident or something, you weren't able to communicate? How are they going to find your emergency contacts?
Check phone, go to list emergency contacts.
Cool. Are they in there?
Yes, it's you, mom, dad, and grandma. Oh, I believe I also added on Kimmy, but I'm not 100% certain on that.
Good job. So that they have a way to contact somebody in case you're emergency, because most people now have phones with them.
Mm-hmm.
And so there are ways, and you can find this information out on our website about how to enter in emergency contacts in your iPhone or in an Android phone. Again, that's a skill.
What about Google's phone?
I have no idea. It's
We
not on
should-
our website yet.
we
We'll
need
look
work.
into that. Okay, so
You
you
need someone
can.
to- you need
I don't
someone
need
who-
to do that. You can do that.
I don't have a Google phone. You need
I
to
don't have a
contact
Google phone. How am I supposed to do it if I don't have a Google phone?
your IT department.
They don't have a Google phone.
No, ask them to see if they can look it up.
Oh, okay. So we'll figure
And
that
then
out.
just think a
Okay.
YouTube video.
Okay, we'll figure that out. Well, yeah, probably just YouTube it up.
Exactly.
Google that crap.
Yeah,
And then be able to tell it how it's probably very simple.
it's very similar.
So emergency contacts, important. We encourage people to have them in the phone.
100%. And it's not as simple as just texting them. You're going to need to call them.
There you go. And let's talk a little bit about how you make appointments.
Joy.
So there used to be a time where you hated talking on the phone.
I want to be in the same room as talking on the phone.
And so I would call up and try to encourage you to talk to them to make an appointment, and you would have nothing to do with it.
Yep. This guy or my mom had to do all my appointment making.
Yep. And that's normal growing up. And then we started
I
to
was
encourage you.
15.
Well, yeah, as you got older, we encouraged you to do it. And so what we did was we had the phone on speaker.
Yep. And I would list out the basics things and then go straight up mute.
And we would just practice, and you would get further along each and every time when you had to make an appointment. But now
I can make my appointments because someone somewhere decided, you know what? Let's make my chart.
So you use my chart to make appointments.
Yes, and I will always carry the banner of my chart.
Cool. So you really like it.
I love my chart. It has basically almost everything.
So when's your next appointment?
Oh, February 21st.
And who made that appointment?
Myself, over my chart.
You had absolutely no help this time in making that appointment, did you?
Correct. They didn't even need to pick up the phone.
All right, good job.
Yay.
All right, and medications. Now, you're not on any medications right now. Oh, what else?
No, I was going to say this was the one you said and everything earlier on.
Yes, learning medications. Good point. I did mention that.
Yes, you did.
Is we want to...
And yes, I am not on any medications. I am on a myriad of vitamins.
And how do you remember to take your vitamins?
First was through the pill case, which was filled by the magical pill fairy known as Mothers.
Yeah, she took care of that.
Yep.
And then what was the next step up?
Refilling it myself and then just taking the amount straight out of the bottle. The required medical amount,
Mm-hmm.
just iterating that in case if a doctor watches these recordings.
And so again, you had this process, is you didn't just start by being able to take your vitamins.
I was
every day.
on medication earlier.
Mm-hmm.
Yeah, I was taking an
And
antidepressant.
did you understand what that medication was for?
It was an antidepressant.
Self-explanatory.
Very self-explanatory.
Did you ever look into
Kind
what
of fell
was-
off the taking of that, though.
Huh? I mean, if
Mainly
you-
because I just forgot to refill the bottle.
Right. So part of medications is refills, is learning how to refill medication.
Yep.
So now do you know how to refill your medication? I have no idea because I've been talking
Yeah.
about this for a while.
Yes, because I'm no longer taking the antidepressants.
So how, if you were on a medicine, let's say you wanted to start to take your antidepressant again, you don't have to, who would you call?
I would tell my doctor at my appointment.
Okay, and then what would your doctor do?
My doctor would contact the pharmacy we regularly use.
Okay, and then how would
I
you get it?
would go to the pharmacy to pick it up.
And would you give them money?
Yes.
Absolutely. You do not have a zero copay, so yes, you will be
Yes,
paying
I
for
will
your
be paying
medications.
for my medication.
And then you run out of that.
I would ask the pharmacy to refill it.
Okay, do you know how to tell how many refills you have left?
That is the one thing I never learned.
So yeah, there is actually on that medicine bottle is the number of refills that you have left that you could just call, give them the number, and
They'll
they'll
refill
refill it. But that number changes every time you get a refill. So when it says no refills left, what do you think you need to do before you get more of that medicine?
Talk to the doctor.
You are absolutely correct. So when we talk medications, we talk about learning how to fill and refill prescriptions, learning what is the medicine for, what are some of the side effects.
Yeah, I
that
love
could
how
be
some
happening.
antidepressants cause depression.
That's
Medicine is causing the thing that is supposed to be medicating.
It is, yeah. That's
Thanks,
a
science.
strange thing going on with some of that. So then we, again, we want the young adult to be as in charge as possible and as knowledgeable.
Right. And you can
About
find your
medications as
medications
possible.
and old appointments and everything on your health summary, which is
That's
handwritten
true.
also on my chart.
That is true. Back in the day, I did not have a health summary on my chart because we didn't have my chart. So what all do you think should be included in a,
Well,
Yeah, thank you. What do you think should be included in a health summary?
the young adults' personal preferences and everything, the medications
Mhm.
they're currently taking, their healthcare team, be it their primary doctor, secondary doctor, favorite nurse, if you don't have a primary doctor or secondary doctor, any other specialists you are seeing, their insurance company they
Mhm.
are using for their healthcare,
Mhm.
their parents and everything, date of birth, and et cetera, et cetera.
All right. And especially when we're talking summary, what we want is we want like a document that's the snapshot of where the young adult is, but also what are the major things that have led up
What
to
are their
that?
goals in health?
Yes. And then what are their goals so that this health summary can serve as part of that transfer of care that we talked about earlier.
Yep.
Is that there's something medically focused that the new doctor can look at and understand within a couple of pages what's going on medically with that patient.
Or just one page.
Or just one page, but there's more to transferring than just understanding
Right.
the medicine.
Yeah.
And that's when we get to about me.
Oh, yeah, 100%.
And so what do you think as you go into a new doctor situation,
Mhm.
besides your medical history, what do you think the doctor needs to know about you?
Dislikes, likes, hobbies, your personality. If you have such and such disorder and everything, that is a mental disorder or a physical one, but it's not a health one that is, well, seeable and everything.
Right,
Because a lot of
right.
sometimes medical physical disabilities are visualized in people.
True. So you want to be able to feel welcomed by that doctor, that they
Correct.
know you when you're walking into the
Yes.
office.
Yes.
All right. So these are just 8 tools that we focus on. There's obviously can be more tools out there.
For all we know, there's 217 tools for healthcare transition.
We don't know, but these are the ones that we've come up with.
Yes.
And that we think as we look at students building and adolescents building up their knowledge to transfer, the skills to take charge of their own healthcare, as well as that attitude of I can take charge of my own healthcare. As we work through at different ages, appointments can start with even young kids checking in at the doctor and going up to the desk and giving them their name and their address, because they still ask me my name and address.
Yep, they even asked me my zip code.
Exactly. So that doesn't have to wait till 18.
No, that's just all the time. You better be a toucan and not a toucant.
It's always better to be a toucan than a toucan.
Yep.
That's awesome.
It's even worse if
Um,
you're a two won't.
Do not be a two won't.
No, never be a two won't.
Don't be a two won't. Readiness assessments are available out there. And what readiness assessments do is it gives you the opportunity to sit down with your child and say, okay,
Or class.
that these are some skills, like we just talked about, that
Or youth
would be
organization.
right.
Because we
It
don't
could be a
know
youth
if anybody
organization. You're
is
right.
attached to, let's just throw it out there. A Muslim community. There we go.
Sure, we don't
We
know.
don't
We
know.
don't know how
We
they're
don't know.
connected. So it could be some sort of community.
Be a
connection.
religious community, could just be a
Absolutely.
community in general that doesn't have access to general health care.
So why do you think it's important to talk about stuff you need to know and stuff you need to learn, stuff you already know and stuff you need to learn?
Key, very key.
Why is that?
Because if you don't know something, you better learn it. And if you know something, you better teach it.
Well, that's a good way to put it, because we don't want to spend time teaching things that somebody already knows.
Right, exactly.
And so let's concentrate on what they don't
know.
So that's an assessment, is you take a look at where you're at and what you need to do to move to the next step.
Yep. And the people at Got Transition are rather amazing at making these readiness assessments in both English and Spanish.
Absolutely. And so we'll include this link on the resource sheet. But Got Transition has some wonderful assessments that you can pull off. And there's also some for diagnostic specific conditions as well that
That's
they have
awesome.
available. Now, one of the areas that pretty much everybody in the world in America goes through is school.
Oh, yay.
And so most of our students, if they're in special education, they will have something called an IEP. And they're also supposed to have something starting at age 14 called a post-secondary transition plan.
Oh, PTP.
PTP. And it is very possible, and we encourage schools to think about healthcare goals in the IEP and healthcare goals in the PTP. And so if you're interested in learning more about the post-secondary transition plan and how your school may be using that, hopefully they're using it, they're supposed to be using it. You can go to the Transition Improvement Grant website and also then link to the app that you can actually go through and fill out your own post-secondary transition plan so that you know what the school is working on.
Yeah.
Let's talk a little bit more about self-advocacy.
Yay, something that is very key for everyone in the world in general, especially those with disabilities.
What do you think self-advocacy means?
Basically advocating for yourself in front of a small group, in front of your family, in front of your school, be it anywhere. It basically means you talk about yourself in a positive way.
Cool. And you get to make decisions
On how to be an advocate, 100%.
Yeah.
That's the whole self part of self-advocacy. It is about yourself. How do you want to advocate for you?
Good job. And one of the organizations that I really like I think do a really good job of self-advocacy, exactly, the Pacer Center out of Minnesota.
Yeah, there's also the Patch Group.
Yes, providers and teens communicating for health.
Yep.
If you ever get a chance to see a patch presentation, it's really good.
Oh, no.
Really well done. Hopefully
Those
your
young
students will
adults
get
are
a chance
amazing.
to. They are. So to sum up, just want to remind you that healthcare is needed and vital in a variety of settings, not just at the clinics,
No.
but also in employment, independent living, succeeding in school.
Be it high school, college, or university.
And then in your journey of self-advocacy.
Yep.
So we want to
we
close
forgot
with
about,
this.
about ADRCs.
Yeah, so just want to close with the brief timeline. You know why I didn't?
Because we are running out of time.
We are, but no, because we already have a whole presentation recorded
Oh, yeah,
on
we do.
ADRCs. It's already
Well,
done.
you
It's
do.
posted. Transition Talks Tuesdays.
Yes.
So just briefly, is the schools will start the post-secondary transition plan at 14.
Or at least
17
attempt to.
Yep, they should. They're supposed to. Aging and Disability Resource Centers, you can call before 17 and 6 months, but they're not going to be able to do anything to help or give you advice or changes or get you started in the program of transferring your healthcare programs into the adult side until 17 and a half. You want to have your decision about guardianship made by 17 and 9 months. That is not something you want to wait till 18 and 1 day,
And try-
especially if guardianship is necessary.
Yep, and if it is none and you did go that route, make sure there is a way for the young adult to have an out.
Well, right, and that's where
Legally speaking.
that's where we want you to look at too, and that's where the next section comes in. Unsupported decision making. Is guardianship appropriate for everybody? No.
No.
Is it appropriate for some? Yeah, absolutely.
Yes, 100%.
But everybody, even if they're have someone else making their decisions, they can still be supported in the decisions that they can make. And
Yep.
they're able to make.
And one of them should be healthcare.
Absolutely. Speaking of healthcare, let's go over a little bit of the timeline that we were talking about earlier. That how do you stay a step ahead? Well, you got to know what the steps are.
Right.
And so at about age 12, hopefully the doctors are making you aware of their transition policy. How are they going to transition you into adulthood? Transition planning should begin about that age 2 at 14. There's a preparation going on. That's where we start to build the skills at age 16. And then 18 is that actual transition of care between 18 and 22. And then the goal is to have by 23, 26 years old, that everybody is transitioned into an adult model of care.
Hopefully.
That's the goal.
Yep.
And so just some final recommendations that we've picked up from other parents is make a plan. Don't wait too long. Record everything. Break it into smaller tasks. We work on that all the time, don't
Yep.
we? Don't
Well,
be
you try to.
right. Don't be surprised if
Don't
things
make a
take
mountain out of a
longer.
molehill.
Right. Don't be surprised if it takes a little longer. Ask questions
Always ask questions.
and then be kind and gentle with yourself.
Yep.
All right. So what you could do for next steps is, let's go to the website, start thinking about what conversations you can have with your child. Think about incorporating healthcare goals into the IEP. Talk to your primary care doctor about, who's going to be the doctor after 18. Make sure you know where your ADRC is, and then absolutely take a deep breath and stay a step ahead.
Yep.
All these resources, such as Got Transition, our website, the Pacer Center, along with an Up to Me program. Yeah, we know that one too. The Board of People with Developmental Disabilities has a healthcare kit. We will send you the links to all these as well. And so those will be in your thing. So this is my contact information. We are going to stop sharing and see if anybody has any questions.
Yay. Q&A time, everyone.
You can either ask them, unmute and ask them, or you can put them into the chat. And right now,
Yes.
I'm going to let you take the questions. I need
Yay.
to step away for a minute.
Yay.
I really enjoyed it, especially all your part, Hunter. It was awesome. I just wanted to kind of add something too, because we just recently ran into this, is when your kids are doing the transition as teenagers too, like the My Chart, some of the information falls off. And for some kids, that's fine. But for others, depending on the situation, the parents might need their primary pediatrician or whatever to get access, give the parents full access if it's needed for like complex medical care or other things like that. So I just wanted to mention that. It's kind of like one of the steps kind of that we've been following as we're kind of going on in the process ourselves. So.
All right. Yeah.
Thank you for sharing.
Yep. Thanks for sharing that and everything. I cannot remember what that is fully called and everything
What?
off the top of my head. Oh, the sharing of information medical wise.
Oh. Yeah, what is that form that we signed?
Yeah.
Oh,
Release of information
there you go.
and everything is the documents that the parents and doctors alongside the child in question would, once they become an adult, need to do and everything, because we discovered that when I needed to go in for an MRI and everything, and this guy wanted to prove that I actually had a brain.
I was wondering.
I do have a brain. It functions wonderfully, and I still have no idea where the music comes from sometimes.
But he was absolutely right. When he went in to have the procedure, we had not signed a release of information because he had just recently turned 18. And so if we wanted to see the results, so we had to ask him if he wanted to share the results with us. He then filled out a release of information to give us permission. And so even after 18, when someone turns 18, is they can give permission to other people to help them make appointments. They can give permission to see their medical records, but it's not as automatic. And this is where a lot of our students who go away to college get a little messed up, because they're like, can you call and make an appointment for me? And depending on the system, they may not be able to if they don't have a release of information on file. They may not even talk to the parent.
Yeah, we just have been running into that with our oldest who just turned 18. And it's so funny, you go from they're not allowed to do anything to they have to do everything. Instead of like,
Yes.
even it doesn't matter, even without any disabilities or anything else, there needs to be like some little interim period where both people are allowed to do it.
Yes,
they-
so an interim period, or if you're not going to have that interim period, which I love, and that's this whole sense of places that have transition clinics where you'll meet with the adult provider and the youth provider, and the family could be there with the youth. And so it makes a lot more sense that way. But if you're not going to have that, at least give the family knowledge about what's going to change, instead of it just suddenly changing and the family not having any access.
Yep.
Other questions, comments? Thank you, Becky.
Oh, no, thank you guys. This has been really good because we have a lot of medical things that we're looking at. So
Any other questions or comments?
I don't have any, but thank you so much for all the information.
You're welcome,
You're very
Susan.
welcome.
And I hope you guys have registered, or at least will show up again on January 24th, where we'll be joined by Tammy Jackson, who's the public policy analyst and legislative liaison for the Wisconsin Board for People with Developmental Disabilities. And we'll talk about supported decision-making and guardianship. Any last words?
No.
Nope. I can't think of anything off the top of my head other than that networking is very key.
Networking is very key, and you usually,
Oh yeah, take your time.
yeah. Yep, that's what you usually say.
Yep, take your time and breathe. Just do your best.
There you go. All right. Well, thank you so much. for
is there
being
a
here
form
today.
we should complete?
What's that, Becky?
Is there a form we should complete or not?
Yes, absolutely. There is a yep. And Becky, I will send that in the email because I forgot to pull up the link.
That's fine. I just thought I would ask since I know there normally is around this time.
Yes,
So
so I would greatly appreciate it, as there's all two of you that made it through here, that when you get the follow-up form, that if you would take a moment to go and fill out the evaluation form, that would be very helpful to us.
And to those watching the recording, please do so as well.
It's a good point. Even if you watch recording, you can still fill out an evaluation.
Yep, because the email is going to be mass pushed out to everyone who signed up for this.
Absolutely. Thank you guys so much for remembering and for showing up tonight.
Yep, thank
We
you for
really
devoting
appreciate
an
it.
hour to this.
Thank you guys too. Great job, guys.
Take
Thank
care.
you.
Have a good night.
You
Bye.
guys as well.